Hello, I'm Emma Cunningham. I'm a clinical academic. I forgot who was there for a second. I'm a clinical academic working half my time in Queen's as a researcher and half my time in the Belfast Trust as a consultant geriatrician. And good delirium care is really just good care by everybody. There are so many facets to it that really make a difference. Do you know, so are there admin staff or people available to answer the phone when concerned families ring? Are there information leaflets printed out and on the wall? Does someone notice if the person's eating or drinking? Does someone notice that the person needs their hearing aids and their false teeth and their glasses? Because if it's night time and you're confused and you're mistaking shadows for people, then your glasses might help in that situation. Or if you think someone's trying to poison you because they're coming to give you medicine and you can't hear that the nurse is explaining to you what it is they're doing. You know, there's so many things there's so many parts to this that everybody can help with. And so yes, it's important that the doctor assesses the patient and the medicines are reviewed. The nursing is really the crux of it. You know, are the person's bowels moving? Have they got 1.5 litres of urine in their bladder? Are they in pain? Are they getting the right medications? Do they understand what's going on? Is someone asking the patient, do you know, are you worried about something? Are you thinking anything that's worrying you? Because it can be really, really distressing for people. Imagine if you close your eyes and you open them up and you're in a bed with a catheter and a vent flowing and someone trying to stick a needle in you and you don't know what's happening. You know, of course, people do really well to be as calm and composed as they are. You know, it's a really tough time for people. So I think it's incumbent on everybody to try and empathise as best they can, to approach people appreciating that they have a lot going on and it's difficult for them to process things. So, you know, everybody's approaching the patient calmly, saying short sentences, using straightforward language. Where possible, you would like their family to be there. Because if I was in that situation and I woke up in that situation, I want my family there to tell me it's okay. But sometimes these people, their families are older, they're frailer, and they're not able to come up. You know, so we're trying to stand in for those family members as best we can sometimes. You know, it's about the person getting mobilised as much and as safely as possible, the person having the right aids available, the person having the right diet, making sure their swallow's safe, their communication is maximised. There's so many facets to the care, and that's why it's difficult to teach, because if there was a clear tick box, sure, wouldn't it all be easy? But it's like care in general, it's not easy, and that's why we're all here, and if we all work together, it's better for the patient, and it's more pleasant for us as well, because when you get this right, you feel like you got the pride in having done a good job. People are in a difficult situation, and we're trying to help them and their families as best we can.